Assalamu alaikum everyone. Welcome back to another episode of the Medical Talk. Today we have with us Dr. Sara Nadeem. Dr. Sara is a consultant endocrinologist and an assistant professor at the Aga Khan University in Karachi. Apart from medicine, she is an actor and a writer, and that's very inspiring for me personally, and I'm very happy to have her here today. Thank you so much for coming.
Thank you so much for having me, Anusha. It's a pleasure.
Thank you. We usually start the conversation by talking a bit about early life. Where were you born and raised, and what was your education like, and how did it contribute towards your decision of becoming a doctor?
So I was born and brought up in Karachi, and I did all my schooling, everything from Karachi until until O levels. I was in the Foundation Public School. And I did my A levels in Karachi Grammar School. And then I went to the Aga Khan University. I was fortunate to get into the medical college there. I graduated from there. And then for further training, I went to the US. I did my residency there in internal medicine. And then my fellowship also there. My internal medicine residency was from the William Beaumont Hospital program in Michigan. And my fellowship was at the Mayo Clinic in Rochester, Minnesota. After that, I was in practice, private practice for a few years, after which I joined academics again and was at the Loyola University Medical Center before I moved back to Pakistan in 2018.
Why did you decide to move to the US for your training? A lot of people prefer going to the UK or just staying back in Pakistan. So what were some of the reasons that contributed towards that decision?
I think at that time, the reasons were that, majority of my class was going to the US for a residency. I'll be totally honest. There were a few people who were going to England. I had been going to the US actually since second or third year to do research in different institutes. I like the United States better in terms of medical training. Whatever I knew at that time, obviously you don't know everything at that time, and whatever I was exposed to. So I had visited the US as a medical student, done medical research with AKU alumni there for since second or third year. And so I found that system to be familiar, and I believed that that would be where I could possibly get the best possible future training in medicine. It was not I don't think a very completely a decision in which you knew everything or you knew all the pros and cons and everything, but that was my decision at that time, and I think it worked out. I did have a wonderful time learning my internal medicine residency. It was very busy. All residencies are very challenging and busy, but it was a very supportive program. My program director there, I think, really helped shape my career as well. And then that was the first stepping stone, after which I went to Mayo Clinic for fellowship. And that was something where I was just so grateful for a long time. I couldn't believe that, did they really take me? What was the reason? But so that was something I'm just so grateful for, because in my wildest of dreams, that was one of the things I'd imagined, that to go to one of the best programs in the world. And when I had the opportunity to go there, I was just like, I'm immensely grateful to God as well that happened.
Yeah. It's definitely a very big achievement, Mayo Clinic, going to Mayo Clinic for a fellowship.
Right. So I'm lucky, and I should get that happened.
So how did you decide your specialty? You did your internal medicine residency and then you did your fellowship in endocrinology. How did you decide that, and what advice do you have for students who are in that phase of their careers right now?
That's a very good question, Anusha, because I'll tell you honestly, when I was first applying for residency, right? So when you graduate from medical school, you have some vague idea, what do I want to be in 10 years, right? They ask you that question also, over and over again in admissions and later on. And I thought, okay, I wanted to do something, which was very fast paced. And initially when I applied for my residency, I thought I would want to become an ICU specialist or an intensive care specialist. So pulmonary critical care, that was my interest at that time. But I did my first NICU or a medical ICU rotation, and I was like, oh gosh, this is not the kind of lifestyle I want for the rest of my life. And I've got really good friends who are pulmonary critical care specialists, but I felt right away that this would not be the best fit for me. During residency, then I had the chance to rotate in endocrine clinics as well, infectious disease, other things. You go, you rotate through many different things. And then I realized, endocrinology was where I seemed to enjoy myself the most. There's a lot of thinking involved. It's not one organ-based specialty. So there are multiple glands involved, and there's a lot of kind of thinking as well as talking to the patient involved. And I felt like that was something that I naturally was inclined towards. And so in my residency program, they did not have an endocrine fellowship. I asked my residency program director that there was another hospital called Henry Ford Hospital in Michigan, and they had a really big endocrinology program. I said, can I do a away rotation there? I mean, it's the same city, but so they gave me permission to do that. I reached out to the Henry Ford program director, and I did a whole month in that hospital system. And there I really went deep into endocrine and saw, what life was like as a fellow, what life was like as a consultant afterwards. And that really made me like it a lot. And so that's how I ended up becoming an endocrinologist.
I think there's a lot of problem solving as far as I understand endocrinology at this point.
Right. That's exactly what it is. And it also, to me, it's not just like, and so I don't want to name other specialties where I feel like you can solve the problem, but then you can't treat it. Like you can diagnose it, but you can't treat it. In endocrine, thankfully, there's a whole process, a system. You go through that, and then you can understand what the problem is. You can make diagnosis, and thankfully, there are treatments for the majority of endocrine issues, which work really well. So you can make a difference also. So it's gratifying as well that way.
So what was your match experience like, and how do you think the system has changed since then?
So it's been a while. So things probably must have changed. At my time, the match experience was the same. There's a lot of nervousness about not knowing where you match. And I actually got a pre-match. So I don't know if that still happens, but I think at that time it used to happen because a lot of programs would give pre-matches to people, international medical graduates usually. And so I had kind of prioritized a local area where I wanted to kind of match. And I made sure that I interviewed just in that radius. So that makes it a little harder as well, because, if you apply all throughout the country of the US, there are many programs, right? Especially in internal medicine. But if you restrict yourself geographically, then, you have to sometimes compromise it. You may not get into a big university medical center. And that was true for me. The residency program that I went to William Beaumont Hospital, at that time it was a community hospital. Now it's a university medical center, but at that time it was a community hospital. And a lot of my class fellows kind of told me, your career is going to be done if you go this route and that kind of thing. But I liked the program. I liked there had been my seniors were doing the residency there as well. Speaking to them, they give some very good feedback, and the faculty seemed to be good. So that's where I think now, as I've gotten older, I feel like one should always trust their instincts. If you get a good feeling, and even though sometimes people or places look great on paper, don't fall for that. What sometimes your intuition or your gut feeling is telling you something, believe it. And so that's what I did. And but for the match overall, I think it's a very expensive process. Even at that time, I remember that. I did not have, a lot of extra resources. So I traveled on Greyhound. I stayed with other old alumni, so we could save money on hotels and travel. A lot of places, a friend of mine from medical school, also we would interview around the same time. We would stay together in one place. That was my experience. Now that I look back on it, I feel like it's a new country for a lot of people, who haven't lived there. I had been there, I had done research there, but I had not lived there, right? Some factors that we don't consider when we are matching, we should think about. And one of them is that, do you have a support system in that area? If you have friends or family, I think definitely that area should get more priority. And then also, obviously, if it is a good academic program, see how the residents and fellows there are. If you feel like they seem overworked and just disillusioned, then that's not the place to be, even though they may be putting out an outward display that they're very friendly. You will really get to the heart of the program when you see how they're treating the residents that are already there. So those are some tips to always keep in mind. Yes, choose a highly ranked program, but look at these factors also, because you'll be spending a great amount of your youth and your life in a residency program. So there's more to life than just the training program. And so also prioritize those things.
I think that's very helpful advice. We usually forget that while being in that phase of applying to the best program, but these factors
Right.
matter a lot as well. So once your fellowship was complete, what were the factors that contributed towards your decision of coming back to Pakistan?
So I didn't come back right after fellowship. I was in the US for 15 years. The first 5 years was my training, for residency and fellowship. Uh, Initially, when I first wanted to go to the United States for training, in my mind, I was always like, I'm going for future training and I will come back and serve the nation. When you're young, those ideals, you kind of believe in them. And then a lot of times you become disillusioned or disgruntled later. My older sister actually believed in that completely, and my brother-in-law and my older sister, they came back right after fellowship from Baylor in University of Texas. And I was very impressed by them. And I was like, if they can do it and they can go back, it's something I aspired to. But I think I lost my way a little bit. I enjoyed the life there as well. And it's hard to say why, at that time, but due to personal reasons as well, was the reason why I came back in 2018. At that time, I was married and my in-laws were getting older. Parents, I wanted to be closer to them. So it was a mutual decision. That was one of the things. I will not say that I had any lofty goals that I'm going to serve the nation. Honestly, it was more of a personal decision than anything. It was more of like, having spent 15 years away from your family, I was like, it would be a good opportunity to be closer to family. And that was my first reason. I still consider the United States home. I had very good friends as well. And I like some of the way that the life is simpler and easier there. There are challenges obviously everywhere. But yeah, so to me, I'm kind of like, when I think if you live anywhere for so long, you kind of, you call both places home. Pakistan is home and the United States is also home for me.
That's great. I think it's good for the medical students here that you came back and contributing to the medical education here by doing that as well.
Yes, I am doing that. But yes, I want to be honest that it's not I don't know. My intentions were not just that कि मैंने मुल्क की खिदमत करनी आके वो अगर हो जाए तो अच्छी बात है लेकिन I mean, I will be lying if I say that was the reason. I came back because of personal reasons.
Dr. Sara, one of the things that I find the most inspiring about you is that you are also an actor and a writer and are doing very strong roles. How have you incorporated that with your medical career? And what is your advice to medical students who have other passions and other interests and want to pursue that along with medicine?
Anusha, I think if you have other passions and interests, you should definitely always make sure you don't forget about them and keep doing something in that field. I loved to write, I loved to act, and I love in my younger days, I used to debate and all of that. But during residency and fellowship, just life got so busy, there was no time for any of that, right? And then it's just work, 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 and then you kind of miss that because that's a very important part of your personality if you like certain things, beyond just your career. And so actually right after fellowship, I tried really hard to get into acting, even when I was in the United States. But, very few Pakistani dramas are made there. I actually reached out to them, but they didn't really pay attention to me. And so I kept persisting. So that's one thing that I did was that I kept persisting. And when I came back also, when I used to tell people or ask people, like if you know somebody looking for an actor, etc. And some people would sometimes laugh at me, like thinking that I'm just joking. Like, why would she want to? She's an endocrinologist. She has a good job. And I would be like, I'm serious. I like to do this. I like to pursue it. They were like, okay. So I actually had reached out to multiple, channels or production houses. And then once when I got the chance to audition, even that person was a little bit skeptical. मैंने जब फोन किया उन्होंने कहा आप वाकई में इंटरेस्टेड है मैंने कहा जी मैं हूँ अच्छा आप ऑडिशन कर लेंगी मैं करूँगी obviously I'll do it whatever the audition whatever is required and I did and I'm lucky that I got one opportunity then another and a third. Now what I've done though is I've said I do get a lot of offers but a lot of the roles are very misogynistic and as you know in our dramas there are newer plots coming out and the last one that I did Dobara was a little different. But a lot of our plots are very, domestic violence ko justify karne wale, and I don't believe in that. So I'm hoping I would still get more roles because which are more kind of women-centric and are not as misogynistic, because the misogynistic zalim ma type roles so bahut aate hain, lekin I kind of turn them down. Writing में ये कि writing मेरे वहाँ पे भी I continued. I actually enrolled for a writer's workshop as well when I was in Chicago. And it is my dream, inshallah, one day to write a book as well. I haven't got there as well, but so far. But I did write, I attended another op-ed workshop as well. And after that, I wrote an op-ed piece in the Chicago Tribune. And that got published, and that was a good achievement. And I've written in the Tribune, Pakistan as well. So yeah, it is gratifying to me. I feel like, one should not be defined by just one aspect of their personality.
Yeah.
We all have multiple aspects, and I'm not just Dr. Sara, I am Sara the person, and as well Sara the person who enjoys acting and who enjoys maybe, I actually love music as well. And yeah.
I think when we as medical students, we get into medicine and enter medical school, we just get lost in all of that, the pressure and the burden and the peer pressure. I think it's very important to not let that part of your personality go.
People judge you also. I'll tell you, I had a couple of people say that, you're a doctor, you're a well-respected doctor, why do you need to act, right? I said, I don't need to act, I want to act, and it gives me joy. And if I'm not harming anybody by acting.
Yes.
So why? So this old concept of log kya kahenge na, ye bhi aata hai, no matter what age you're at. And I was just like, if you like to do something, you're not hurting anybody's sentiments, you should do it.
In fact, you're contributing by doing better roles and doing roles that are empowering women. Great.
I try to. I hope we can get more of those.
You're also the co-founder for Women in Medicine. That is an organization that does work for female physicians to get better and equal opportunities as male counterparts. So how has that experience been? Because there is an issue of Dr. Bahu and how women discontinue their careers after their marriage. So how do you think that we can solve this issue, and what are some of the problems you have seen in our culture and society related to female physicians?
So Nisha, the Pakistan Women in Medicine group came about. Our chair of medicine at the Aga Khan University, Dr. Zainab Samad, she had also moved from Duke. She's a cardiologist. And I had worked on a Women in Medicine initiative at Loyola in Chicago. So we both had a similar vision and we launched it. It's within the department as well, but outside of the department, we launched a Facebook group and a WhatsApp group as well as Twitter. And our focus initially has been on more of advocacy and actually talking about the issues that exist. We have not been able to come to larger policy changes outside of AKU. After the Women in Medicine Committee was formed, our Associate Dean of the Medical College actually launched another group called the Women Faculty Forum. And he made me the chair of that. That group has actually led to policy changes within AKU, which to make it more women-friendly, accessible for women faculty to continue on in their faculty roles and be supported. So in terms of having lactation rooms accessible to everybody, having a better maternity leave compensation policy, those are two of the things that the Women Faculty Forum has been able to achieve within AKU. And we are working on another initiative, which is about a flexi full-time option, in which, when somebody goes part-time and people have younger children or other responsibilities, usually that responsibility in our culture falls on a woman. Even worldwide it does. And so what happens is the woman in medicine will go part-time and then they will be active and won't be able to go to Dr. Rehana Kamal was an anesthesiologist at AKU, and many years ago she had actually advocated for flexi full-time, which is an option in which you can cut down your hours, but yet you still will be able to be promoted based on your accomplishments. So we're trying to make that more widespread. So I'm fortunate that AKU actually has a lot of women in leadership positions. And in the last few years, we've had a lot of promotion of women as well, because the initial dilemma was that there were a lot of women in the initial stages of the faculties, which is instructor or assistant professor, but less and less women as associate professor and professor. So that is changing gradually. Outside of AKU though, overall in society, like you've talked about the Dr. Bahu phenomena, and Dr. Farhat Mozum has done a lot of research on that from SIUT. I think our society needs to really look at that. Even women themselves, right? How we raise our women, how we raise our daughters, and how we raise our sons.
Yeah.
Change has to come from there, right? If we raise our sons to believe that somehow they have the right to pursue their careers and excel in their careers, and a woman, although she is also a doctor and maybe more qualified and more successful than that man, then there is a lot of pressure from misogynistic communities like ours, that the woman should step back and take a smaller role.
Yeah.
And men feel threatened about successful women as well. And women who are doctors, they are intelligent, hardworking women. They're not any less than their male counterparts. So we have to change that mindset, because if the women are also against a strong woman, then it's a very hard battle, right?
Yeah, that's true. The misogyny is very deep rooted. I was talking to someone when the MCAT time comes, female medical students tend to score higher on the MCAT. So he was
Right.
saying that there should be a different merit for female medical students and male medical students, because males, for some reason, they cannot score higher than females. So there should be some cutoff difference for them. And it was just beyond my understanding how
Right.
it makes sense.
Like he would even think that and
Yeah.
say that, and he has no idea that what he's saying is just like incredible.
It's the same test, so how does
Right. It's
yeah.
right. Because it's very hard for that person to accept that, because those women score higher because they are maybe more intelligent or more hardworking, right? And a lot of times women have to work double hard than their male counterparts to prove themselves, right? But my suggestion is that the new generation like you is like gradually change the system by talking to our male allies as well. It's not about us versus them, it's about all of us working together, and when there is an issue, actually talking about it, pointing it out to them, and also to our elders, right? If the we have, thankfully my parents have been very supportive. We have 4 sisters, and we've always been, my mother, for my mother and my father both, it was a priority that we should be financially independent and be able to stand on our own 2 feet no matter what, right? And they've been told when we were younger, some people said कि आप बच्चों पे इतनी पढ़ाई, बच्चियों पे इतनी पढ़ाई पे क्यों खर्च करती हैं? And my mother was like, बड़े लड़के होते तो ठीक है, लेकिन, and my mother was like, इसमें क्या फर्क है? So my mother is like, very straightforward about it. And so we believe that जो पैसे लोग सेक्स पे और शादी के बहुत सारे खर्चों पे करते हैं, they should actually invest that in a good education, because that is forever, right? You can have a simple marriage ceremony, but and yet give your daughters and your sons better education, if that's within your reach, or let them work hard for it either. I'm okay with people like the parents के पास नहीं है to give a lot of money for their education, then still women and men should work hard. थोड़ा सा struggle करना चाहिए, I think, if you want to achieve things.
I think the society will eventually change when we have conversations. That's very important. And don't hold back when talking about
right. Don't like bite your tongue and be like, अच्छा ठीक है, I won't say it. And sometimes it is there, na? Some people will be like, बहस नहीं करो, especially if you're younger, or बात नहीं करो, और ये तो ऐसे ही है ना, आप बड़ों को तो नहीं बदल सकते. But क्यों नहीं? Actually, my nani, mashallah, she is, I think, one of the most progressive people I've ever seen from her age too, because she's always like, like, do your own thing, stand up for your own rights. Don't let anybody treat you disrespectfully. Don't tolerate abuse of any kind, because why? Just because somebody is a woman doesn't mean they have to suffer in silence. Don't be that person.
That's very important. I'm so glad that we have people like this in our generation and the older generation. And inshallah, I think things will change in the future.
Inshallah, I have a good feeling. Yeah.
You are also a professor for endocrinology at the AKU Medical College, and you obviously interact with a lot of medical students on a daily basis. What are some qualities that you want to see in medical students?
I'm an assistant professor. I'm the coordinator of the year for medical students at rotating endocrine. So I'm actually very specific about how a history should be taken and presented. I feel like in medicine, that's the crux of everything, right? You have to get the story right. And I tell them it's just like watching a good movie or reading a good book. You can't have gaps. You can't go from the present to the past and फिर आगे पीछे. You have to have a nice story. And the patient will not give you that order, but you have to put it together in that order. That's our job as a physician, is that we get all the clues and the history and we put it together so that we can have an assessment which will not miss anything, and then make a plan based on that assessment. I tell them that you can have gaps of knowledge, that's okay, because in this day and age, you can always access knowledge, through your phone or otherwise. But your attitude and your professionalism is something that you can't get online. Yeah. So that you need to practice and rehearse. Be honest, work hard, right? Be there on time, be professional, be respectful, be open uh, to learning, right? If you just show up, okay, it's a rotation, I'll, 2 week rotation, I'll, get through it anyway, right? Yes, you can get through it like that, or you can pre-read your material and show up in clinic knowing some information and then asking questions which actually will get you more information and you'll remember that. So my advice to the medical students I interact with is often that, you all are adults by the time you come, in medical school, and about the age of 17, 18. And it has to be self-directed learning. And then good mentors can guide you. But if you expect that, you will just show up and things will just fall into your lap, that you won't really go too far with that attitude.
Yeah, I think the attitude is the most important, as you mentioned, because it's a continuous learning journey where the attitude will take you further.
Right. So I don't mind if somebody doesn't know anything. I mean, they read something or they were wrong about it or they thought through. But if you haven't even read anything and then you just randomly show up, that's something which sometimes, really gets, is a pet peeve of mine. And so I kind of fixate on that.
We talked about medical education and medicine. How do you see medicine and medical education 50 years from now, especially in Pakistan?
I hope to see that it is, where both teacher and student have more of an engaged discussion. Obviously, even now at AKU, we have simulations and simulation-based learning and case-based learning. So hopefully that is made accessible throughout Pakistan. People doing medicine who actually want to do medicine. That's, I think, also key, right? Just because you have the best, the highest numbers, shouldn't automatically mean that medicine is the career for you, because maybe, you don't have any interest in there, right? And even in medicine, there are different fields. Not everybody needs to become a physician, a general physician or a specialist or a surgeon. There is pathology as well. There are basic sciences, the radiology, different fields that fit a person's personality better. So I wish for that. And I'm seeing that, a lot of focus now, and there are other options available within medicine as well. So that, when I was in medical school, our goal was either medicine or surgery, right? But now the other specialties are also coming in the forefront. Some people are going into public policy, public health. That's also very important. So having those options available to more people across the country.
A lot of medical graduates, when they graduate, they feel that there is a lack of opportunities in Pakistan in particular for medical graduates. So what are your thoughts regarding that? How can the government and the society improve that?
So I think how the government can, on a public policy level, change that is actually compensate junior doctors better, right? Because junior doctors, they have young families, they need to support themselves as well. And the stipend that is paid for the hours that they work is not enough.
Yeah.
And so that's one thing, that because when you do that, you're telling them that they value your service as well, right? Second is regulating it in a more comprehensive way, I think, from a central level, how all these different medical schools are teaching. And so when they graduate, everybody has a similar skill set, because I think there's a lot of discrepancy in the amount of skills from different medical colleges. That's there too. And so some graduates struggle there about what to do after they graduate from a medical school, which may not have given them the same basics as another one, right? So regulating that. And then again, actually encouraging residency programs in smaller towns as well, not just in the 4 or 5 big cities of Pakistan, that all of the training is done there. They should have residency training programs in even middle to small hospitals. But all of that requires regulation and making sure that that's of high quality and well compensated.
I think that brings us to the end of the interview. Thank you so much for coming. I'm sure that everyone listening will find this really helpful.
Thank you so much, Anusha. It was a pleasure talking to you.
Thank you.